In Chapter 5, we talk about bacterial diseases that are acquired through the alimentary route. So, discussing bacterial diseases that are acquired through the alimentary route, the most common of these diseases is going to be food-borne illnesses. And food-borne illnesses are not actually food poisoning. The majority of people will say they had food poisoning. The food itself is not poisoned. It's the toxin that the bacteria gives off that's poison. And when you ingest that toxin, that's when you get sick. So it's not necessarily the food that is poison. So we'll talk a little bit about a couple different foods here that are actually poisonous, just like a poisonous snake or a poisonous spider. The food itself is poisonous. But when you have food-borne illness, a lot of people like to call it food poisoning. It's not. It's the bacteria itself that starts to colonize and break down, and it gives off a toxin that makes the individual sick. Food infection is caused by ingesting live organisms that colonize in the intestinal tract. So you can see there's a difference from ingesting food that has a bacteria in it, and then once you ingest that food, the bacteria starts to colonize and give off the toxin. But an actual food infection is caused by ingesting live organisms that colonize or start to multiply in the intestinal tract. True food poisoning is when a food such as there are species of mushrooms or different shellfish, that should say shellfish, not shellfish, are ingested and illness occurs because of the toxins in that particular food, like the shellfish or the mushrooms. I know there's trying to think what the mushroom is. I want to keep saying it's a toadstool. It's called a toadstool. And people back in the day used to go out and pick their own mushrooms to cook, and the toadstools grow very common, but they are super poisonous, very poisonous. So if you don't know a thing about picking mushrooms, then or the different types of mushrooms is something to definitely stay away from unless you buy it at a grocery store. Some bacterial diseases are acquired through the alimentary route, which causes gastritis, and serious bacteria are usually caused from food and water. So the World Health Organization, also known as WHO, came up with 10 what they consider golden rules for food safety. And a lot of these, people take for granted, and a lot of them people really don't, haven't been properly trained on it. The first one is choose food processed for safety. So when I just mentioned about the mushrooms, okay, you don't know anything about those mushrooms, don't go out and pick them because they really haven't been, no one has processed them to make sure that they are, they're grown safely or that they are a safe mushroom to eat. The next is to cook food thoroughly. And I know a lot of us like to eat our, our beef or our pork a little more rare. you have to make sure that the food, especially hamburger, is cooked thoroughly. Eat your cooked food immediately. Don't let it sit around so that bacteria can grow. Store your cooked food carefully. There's always kind of been a little controversy. Do you let the food come, once you cook something, say you make a pot of chili, do you let that come back down to room temperature and then refrigerate it? Or do you shut it off and it's still scalding hot and put it back, or put it in the refrigerator? And really, they've gone back and forth on that for years, but really where it's at right now is refrigerate within 2 hours of cooking it. So that's kind of your rule of thumb. So if you make something, you sit down, you have dinner, you have leftovers, within that 2-hour period, you should be able to put that food, wrap it up, and put it away in the refrigerator. Reheat your cooked foods thoroughly. Avoid contact between raw and cooked food, which I think is kind of a no-brainer, but I remember a few years back, I was, well, probably more than a few years, but I was working at a dental office, and the one girl brought in hamburgers to make on like a little George Foreman grill for everybody. She thought she was being nice, and she put the raw meat on a dish, which is fine. And then she took the hamburgers off the George Foreman grill and put them back on the same dish that had the raw meat on it without washing the dish thoroughly. So anything that's raw should not be in contact with anything that's cooked. Okay. The same goes for cross-contamination of meats and vegetables. If you're having steak, you're not going to want to chop up that steak on when it's raw. Say you're going to trim it. You're not going to want to trim it on the same cutting board that you're going to chop your salad on. You know, even if you just wipe it off, that's still not really sufficient. You really need to wash. And I always use like a bleached spray on anything that raw meat touches, especially poultry, because it is one of the biggest contaminants. But you never want raw and cooked food to touch for that reason. Another no-brainer, especially all of us that are in healthcare, wash your hands repeatedly. We've all been in the bathroom and seen someone come out of a stall and walk right out the door without washing their hands. Like, no, you have to wash your hands all the time. Remove anything that's on your hands, especially if you're going to be touching any food. They need washed all the time. If you're touching, say, chicken, preparing it for dinner, you're going to want to wash your hands 2, maybe even 3 times in between going from that raw chicken to going to make your salad or whatever else you're going to make. Keep all the kitchen surfaces meticulously clean. Like I said, I always use like a Clorox bleach spray on my counters all the time, just because I'm neurotic about foodborne illnesses. Protect your food from insects, rodents, and other animals. A lot of people, excuse me, don't realize, if they have mice in their house and there's, mice droppings in a cupboard or something. That happens a lot in the country because you almost cannot avoid it, but you have to make sure that you get rid of the rodents and that the mice droppings are properly disposed of. And the last thing is use pure water. And that sounds like a no-brainer for us also, but there's a lot of people that go out and do a lot of camping and hiking, and they think that they can wash their pans or their dishes in the stream. You cannot do that. There's just way too much bacteria that's growing in streams, lakes, everything that that can lay stagnant at times, bacteria can grow in it. So always use pure water. And remember, when you go out of the country, they do not have the same sanitation that we have. And that's why a lot of people that go to Mexico, the first thing they say is don't drink the water, don't drink the water. But you don't want to brush your teeth with that water. You don't want to wash your face with that water for fear that that water will get into your mouth. So you have to be super careful about going out of the country into any other country, because remember, the sanitation and the public health systems and the infrastructures are not like the United States. So there are microorganisms that grow, within their water systems that they don't check for. So the first food intoxication we're going to talk about is Staphylococcus aureus, which we've already discussed in, discussing the sore throats. Okay, remember we said that staph is humans are the reservoir for staph, and it inhabits humans. It can live on their skin, and most people are, pretty much immune to the staph entering their body. So if you have staph on your skin and there's a break in your skin and your immune system isn't where it should be, you might be a little immunocompromised, maybe run down, whatever, that staph, your natural immunity will not take over, and it will allow the staph to grow. Okay, that's where this is talking about. It's responsible for boils and other infections. It is responsible for skin infections, and remember, MRSA, which is methicillin-resistant Staph aureus, is it's a staph. It lives on your skin. However, the MRSA is more dangerous, or is super dangerous, I should say, not more dangerous, because it's resistant to the penicillins that are usually used to treat staph. So we have, staph lives around us basically. Usually people that get food intoxication from Staph aureus is they have eaten food or ingested food that the staph has been in and that's multiplying in. Okay, so like I said, it's also responsible for boils and other infections. It can be caused, which is very rare, by cows that have infected udders. Their udders where the milk comes from, if they have staph on it, it could, definitely go into the milk, and someone who drinks the milk can get sick from it. But in this day and age, the majority of milk is all pasteurized, unless your child goes on a little, and a lot of these have completely decreased. But if they go on like a little field trip to a farm, they used to let them drink milk from the cow. They pretty much don't do that anymore because of the opportunity for the child to get sick from it. Symptoms from Staph aureus can be anywhere from 30 minutes to 7 hours. So typically, the majority of people that, get sick or have some sort of what they call a stomach flu, they think it should happen right away within, 4 to 6 hours. With Staph aureus, yes, the onset of it is very quick. It could be anywhere from 30 minutes to 7 hours. The typical incubation for it is 2 to 4 hours. So that means if you go to the restaurant and you have, say, a salad with a nice creamy dressing on it, and an hour later you start getting really bad stomach cramps, yeah, chances are you probably came down with Staph aureus. But there are a lot of other foodborne illnesses we're going to talk about, that the gestation or the symptoms can be, up to 4 and 5 days after you've ingested the food. So just kind of keep that in mind. If you get sick right away, it's probably going to be from Staph aureus. Usually it peaks in the summer, okay, when we're all having our picnics and we set our potato salad or our macaroni salad out that has the creamy base, the milk base, and it's not cooled or chilled properly. Okay, so you see a lot more of it where people get, Staph aureus in the summertime. Also during the holiday season, and the reason during the holiday season is because, once again, we're going to holiday parties, we're going to buffets, and food is sitting out, which gives it the opportunity for this organism to grow. Transmission of Staph aureus can be pre-cooked hams, milks, custards, cream fillings, salad dressings, okay? So anything that has like a milk base to it, you should be careful with how that is handled. So like I said, with the salad dressings, if you go to a salad bar and the dressings are not refrigerated or chilled, do not eat them. Do not take salad dressings to your office or to wherever you work and not refrigerate them, especially if they have a cream base, because chances are you're going to end up sick. Custards, cream fillings, like, I know it sounds kind of crazy, but if you get donuts with cream fillings, do not leave them out. They need to be refrigerated. The same with pizza. I know it sounds crazy, but pizza, remember, has cheese on it. And when I was growing up, if my mom made pizza, we left it out, and the next morning we'd get up and eat pizza for breakfast or whatever. But now, if we get a pizza or I make pizza, it's put in baggies or foil or whatever and refrigerated immediately because it can grow on the cheese. So you want to think of anything that has that milk base to it can grow Staph aureus. The source of food contamination is usually a person with an infected lesion on the hands, arms, or face. So somewhere along the line, the individual that's handling, that's how, let me go back and say this differently. The Staph aureus can grow because it's there. But if you have food that's contaminated, actually contaminated when it's brought in, say someone brings nice, beautiful potato salad and it's it's chilled properly and it's cold, but if the person that was making it had an infected lesion on their hands, arms, or face, they are going to contaminate that potato salad. Okay, so you kind of always have to think about that. When you go to a restaurant, you really have no idea if somebody has, an active staph lesion. The symptoms are usually very quick with a very violent onset, which is different from other foodborne illnesses. So that's how like I said, if it's within 30 minutes to 6 or 7 hours, that's a quick onset. It's probably most likely going to be Staph aureus. The individual has nausea, can have vomiting, a lot of cramping, and diarrhea. The biggest problem with Staph aureus is the fact that the individual is, vomiting and having diarrhea, that they're going to have an electrolyte imbalance or fluid loss. So if necessary, IV therapy. A lot of times individuals, they throw up for 24 hours of diarrhea and throw up for 24, 48 hours. They end up in the emergency room. They give them, some electrolytes and some fluids, and usually that really helps the person feel much better because they can't keep anything down. Prevention is going back to anybody with any sort of skin lesions should not be preparing food. Go back to the World Health Organization's 10 golden rules, proper food safety. And a lot of people that say they have the stomach flu, they really don't have the stomach flu. They have this Staph aureus infection. In fact, I would have to look up the statistics on it, but the majority of people that think they have a stomach flu, it's really not a stomach flu. It's a food intoxication or a foodborne illness. So the next bacteria we're going to talk about is Helicobacter pylori gastritis. And that is basically, if I don't know if you probably work in a hospital setting. I'm sure you've heard of the H. pylori bacteria. And it's a chronic infection that can be eventually associated with stomach cancer. It is an inflammatory response to, let me go back and explain that a little bit better. Your body has an inflammatory response to the actual bacteria that leads to changes in the tissue within the stomach, in the stomach lining, and it causes tissue death. Most people that have ulcers will be checked for H. pylori because that is going to be the #1 cause of ulcers. They used to think ulcers had to do with nerves and stress. I mean, they do have to do with excess acids in the stomach, but H. pylori could also cause the excess acids in your stomach. So anybody that has stomach issues and has been diagnosed with an ulcer should have, it's a blood test to test and see if they have the H. pylori bacteria. A few years back, maybe about 5-10 years ago, they went through pretty much anybody that was having any routine blood work, they were just automatically doing an H. pylori test. And then they kind of got away from that because they were finding less people rather than more people had the bacteria. So it really wasn't necessary unless someone exhibited symptoms. Most people are infected as a child, and then that bacteria just lives in their stomach until adulthood. They do not know, transmission is unknown, and usually with H. pylori, it's a treatment of a protocol of antibiotics and proton pump inhibitors, which are acid reducers for your stomach. So they want to reduce that acid as well as kill the bacteria. Next, we're going to talk about Clostridium perfringens. This is a food intoxication or a foodborne illness of mild and short duration. The incubation is anywhere from 6 to 24 hours, but its typical incubation, the median of it is 10 to 12 hours. So once again, going back to what I said about, people eat something, yesterday and they get sick the next day, they think it's stomach flu because, they ate it yesterday and not 2 hours ago. But a lot of these bacteria take some time to incubate and colonize. This particular bacteria is generally associated with improper cooking and handling of food methods. The transmission is in soil or feces, and then held under conditions that allow the organisms to grow and multiply. You see it more frequently in meats that are heated, in gravies that are kept warm. So you see it in institutions where they make larger batches of food, where the foods are going to sit on warmers to keep them warm until they serve them. You see them usually in restaurants that don't have adequate cooking or refrigeration methods. Preparation in large batches, like I said, like schools, restaurants, prisons, nursing homes, where they're making a lot of food for a lot of people at one time. The symptoms are pretty, standard: cramps, diarrhea, often nausea, but there's rarely vomiting with it. So there's a difference there between that and staph. You can see staph, there's excessive vomiting with. Is there treatment? Well, the only treatment really that they have for it is going to be if the patient, ends up, being so sick that they have diarrhea, watery diarrhea, stool for several days, they become dehydrated, they can't drink. Well, then they're probably going to need to be rehydrated with IVs. So that's probably, the most you're going to see. The next bacteria we're going to talk about is botulism. And Clostridium botulism is a severe intoxication from the exotoxin. So remember, an exotoxin is the toxin that is emitted from the actual bacteria itself. It is life-threatening. It can be fatal. It has paralytic diseases associated with it. It is not just a disease of the alimentary canal. It is a disease that becomes systemic. When it's ingested, it's absorbed into the intestines, resulting in paralysis of the cranial and peripheral nerves. So it isn't just emitted through bowel movements, it's absorbed. So that exotoxin is absorbed into the system and starts to affect the cranial and peripheral nerves. You saw a lot more botulism when individuals did more home canning and preservings, but you will still see some outbreaks in particular families. Not many families. I mean, some of us do. I do some tomatoes every year. I don't even can them. I freeze them because I don't want to even be worried about, was the temperature high enough? Was, the pressure that you need to have high enough? I don't even want to worry about any of that. My mom canned anything and everything, and I never thought twice about it. But now I really don't even want, like, if someone brings me like their homemade canned tomatoes, I really don't even want them because I'm super neurotic about, as I've said, foodborne illnesses. But there are some families that still can and preserve, and you'll see an outbreak possibly in one or two particular families based on how they can their food. There have been some cases, but very, very few, especially in this day and age, that have been traced to commercial canning. And if you look at the incubation on botulism, 12 to 36 hours. So now we're going to a day and a half of someone getting sick. The shorter the incubation period, the more severe the disease is going to be. And that's just because if you start having symptoms at 12 hours, you've got a bad case because it's breaking out really fast. So that's a lot of how the individuals, or how the doctors know how to treat these particular individuals based on, once again, the incubation, how long after they ate that food did they get sick. Without treatment, a third of the patients will die within 3 to 7 days. So, like I said, it is a very, very serious foodborne illness. And back in the day, long time ago, even before my time, people used to can their own meat. And botulism was a big culprit in canned meats. People don't do that anymore. They don't can their own meats. You see it a lot more in like fruits and vegetables, actually, that are being canned. Recovery is sometimes as long as years. It's because it affects your peripheral nerves and your cranial nerves. It takes a long time for those nerves to heal, for that patient to start to feel better. Transmission from the disease is eating foods that have been inadequately cooked, allowing the toxin to form. Home-cooked fruits and vegetables, smoked or home-prepared meats, sausage, or fish are big culprits in botulism. The largest outbreak of botulism in the United States occurred in El Paso, Texas, at a restaurant where the restaurant wrapped their potatoes in aluminum foil, and then they baked them, and then they were held at room temperature, so they were never refrigerated, for several days before being used for a potato-based dip. 30 people were affected, and 4 required mechanical ventilation, so basically they were on ventilators. So, we learn from each one of these cases, food safety. We learn a little bit more about food safety because, like I said, I'm older than probably the majority of you at 54 years old, but I can remember when we had baked potatoes, my mom would leave the baked potatoes out, and she might cut them up the next day and make fried potatoes with them. So, these are things just to keep in mind for your own food safety as well. You don't know when that particular organism is going to grow. And once again, botulism pretty much, it's not 100% fatal, but 33% of the people that get botulism die. Those are odds I don't really want to challenge those odds. The symptoms, the individual's dizzy, obviously, because it's affecting the cranial nerves, difficulty swallowing, and they have double vision. Then they start with nausea, vomiting, diarrhea, paralysis, and death will occur from there. The paralysis of the respiratory system is usually what causes death. It paralyzes the respiratory system. The individual cannot take in any air, and they die. So you can imagine back, in the olden days when we didn't have, access to the hospitals and so on. It was a big deal because everyone canned their own foods to make sure that they were canned properly, because botulism was always a possibility. The treatment for botulism is intramuscular or intravenous administration of the botulinum antitoxin. So it is like a poison. So it's like if you get bit by a poisonous snake and they give you an antitoxin, this is kind of the same thing. It's poison, so they have to give you an antitoxin in order to reverse the progression of that organism. Prevention is education on home canning, proper techniques regarding time, pressure, temperature, storage, and cooking. Like I said before, I I used to like to do a lot of canning because my mom did, and I've really gotten away from it just because I know what I know, and I'm always a little bit nervous about home canning. Any jars, any cans that you get that are not sealed or don't seem like they're sealed, if they're bulging in any way, they shouldn't even be opened or used. Just throw them in the garbage. So, tomatoes are a big culprit of botulism. So, if you buy tomatoes, canned tomatoes, and you go to open it with a can opener, and it pops, that's pops like where the tomatoes come out. It's not a good sign. Not saying it's botulism, but it's something has grown in there. Just pitch them. Don't take the chance. The next bacteria that we'll discuss is hemorrhagic colitis, which is E. coli 0157. It's got its own name. E. coli itself is a normal inhabitant of intestines of all animals, including human beings. It's actually so common that when you test a swimming pool or the bigger facilities that test their swimming pools, they test for E. coli. And that's how they determine if the water is safe to swim in. Because if you have your own swimming pool, like we have our own swimming pool, and pretty much just myself and my spouse use it, and some friends. We don't have children or anything that are swimming in it, that are going to the bathroom in their diapers, while they're swimming. But in bigger pools, commercial pools and hotel pools, people put their kids in the pool or the baby pool, and they have diapers on. So the E. coli goes into the water, so they test for that E. coli. They test for the amount of E. coli that's in the water to make sure that it's safe for people to swim in. It's it's a good bacteria. It suppresses the growth of bad bacteria in the intestinal tract, and it also helps with the synthesis of vitamins. There are 6 major categories of different strains for the E. coli bacteria that cause diarrhea. Most of them cause mild illness. Most of them, I don't want to say are, really not significant, but they're not significant. But E. coli 0157 is what you hear about on the news all the time, with ground meat being recalled, restaurants being recalling different, not recalling, but having outbreaks of E. coli. The reason being is because it's the E. coli 0157. So I just said we have 6 different strains of E. coli, but the 0157 H7 is going to be really the most dangerous that we have come across. And this was really kind of recognized in 1982, and it causes severe damage to the lining of the intestine, which causes hemorrhaging. So that's why they call it a hemorrhagic colitis, because it's an inflammation with hemorrhaging. The initial outbreaks were first associated with two different restaurants of the same fast food restaurant, in uncooked or undercooked hamburger. I want to say it was White Castle. In fact, I know it's White Castle that this all first started with. And 1983, more outbreaks occurred in a new dangerous version that they called hemolytic uremic syndrome, which was found in like 5 to 10% of the cases reported. And these cases are usually children that are less than 5 years of age that will develop this from E. coli 0157. The thing that makes ground meat different, okay, so when you buy, say you buy a steak, and you cook that steak and you eat it rare and you don't get sick. The reason is because that steak is cut from one piece of meat, okay? Most ground meat that you buy is cut from all kinds of stuff that's left over, okay? So it's cut from ends, pieces, stuff that might have fallen on the floor, in the in the slaughterhouse. And remember, E. coli is found in the intestine. So if it's at all contaminated with feces from the beef, when they grind all that up, the E. coli is going to live. If you cut it from like a prime piece of meat, from a piece of meat, you're cutting a clean piece. The ground meat is not clean. The ground meat is going to be pieces and scraps. Like I said, I hate to say stuff that maybe has fallen on the floor, but that's where ground meat usually comes from. So although they test all this meat, I shouldn't even say they test all of it. They take samples of different batches to make sure that the ground meat is safe from E. coli 0157 for consumption. There's always that possibility that they didn't test the right batch that possibly has it in it. So that's kind of the difference between eating a clean cut of meat rare versus eating a burger rare. I like my steak medium, so it is a little bit more rare, but I will never ever eat a hamburger that isn't anything but well done because of E. coli 0157. And here we go again. The incubation period, 3 to 8 days. The average, 3 to 4 days. So you could have eaten a hamburger 8 days ago, and today you're sick. And you're associating it with maybe what you ate for lunch, but it could be something that you ate 8 days ago. So whenever you get sick, whenever you have any sort of an intestinal problem, disturbance, you need to go back and start thinking about what you ate when you ate it so that you can kind of narrow down what it possibly could be. As long as the organism is being secreted through feces, it's communicable. So what ends up happening is if someone has E. coli and they defecate, they wipe themselves, they don't wash their hands or wash their hands properly, then they touch something else, that E. coli is spread. Okay, so ingestion of the contaminated food or water is how it's transmitted, and it's also transmitted from person to person. I'm trying to think how many years ago it was. Maybe, 8 to 10 years ago, there was a huge E. coli outbreak in California, and then it started spreading to other towns. And here, what they had found out was that the E. coli was in spinach, fresh spinach that was sold in the grocery stores, and it was from cows that were in the next farm over. Their manure, water, washed the manure down into the spinach crop, and when the spinach was growing, the E. coli was incorporated into the spinach, and a lot of people got very, very sick from that throughout the United States. The other one I want to say was with scallions, the little scallion onions. Same thing. It wasn't from cattle, but it was from workers or vegetable pickers that were defecating in the fields while they were working. And then, of course, when it rains, it goes down into the soil, and then you know how scallions, which are like little tiny mini onions, they grow in layers. That E. coli grew in the layers of that onion, and or those scallions, and I want to say it was Taco Bell. I want to say that one came from Taco Bell, and there was another one that was trying to think, Sheetz gas stations where they have them made to order. It was the tomatoes that were contaminated with E. coli. And it all had to do, they had to narrow it down, who got sick, where they got sick at, and where they got their vegetables from. So they can narrow it down to what farm distributed to that particular restaurant, and that's how they can narrow down the E. coli 0157 to that particular restaurant. Hamburgers and other meats can carry E. coli. Apple juice, we've seen outbreaks in apple juice, coleslaw, cheese curds, jerky made from deer meat. They did have a big outbreak of alfalfa sprouts, and they actually quit selling them there for a while. Now they're back on the market again. The fresh spinach I just talked about. So, you know, a lot of it isn't how you handle your food. It's how it's being grown and how it's being distributed to you to buy. So I'm actually signed up on something called Daily Recall, and every day they send me an email about anything that's been recalled in general, but my most concerning area, of course, is going to be foodborne illnesses. The symptoms are severe cramping and diarrhea. Those are initial. At first you have watery diarrhea, then it turns to blood. Because remember, it is very irritating to the lining of the intestine, and as the feces passes through, it tears the lining of the weak intestine and causes the bleeding. The individual can have occasional vomiting and a low-grade fever. Generally, it lasts 8 days. If it turns to the HUS that we previously discussed, it can lead to permanent loss of kidney failure. And that's what you will see in one of the videos where one of the little girls who ate one of those cheeseburgers at White Castle ended up in kidney failure. If the individual ends up with HUS plus a fever and neurologic symptoms, they have a death rate of about 50%. So you can see although there's treatment, there's still a mortality rate of half to live, half not. The treatment generally is going to be fluid replacement, because what happens, obviously, the person has diarrhea, they're vomiting, they can't eat, they can't drink, so they cannot, their bodies cannot replenish themselves nutritionally. So generally speaking, that person's going to be in the hospital at some point in time. And prevention of E. coli, like I told you the little story about the girl that I used to work with that put the raw hamburger on the same plate that she the cooked hamburger. Know your World Health Organization's 10 golden rules for food safety. Next, we're going to talk about Shingalus. It's basically a dysentery, bacillary dysentery. Shingala is an intestinal disease. You most often see it in children aged 1 to 4, also in the elderly, debilitated, malnourished, and immunocompromised patients. Its only reservoir is the human intestinal tract and infected feces. The incubation period for Shingalus is 1 to 3 days. The disease is communicable or contagious until the organism is no longer present in the feces, which is usually about a month after the initial onset of the illness. Transmission, like a lot of our foodborne illnesses, are fecal-oral transmissions, or indirectly through contaminated objects such as, pots, pans, cooking utensils. It can be in water that's contaminated or food that's contaminated. Primarily from individuals that fail to wash their hands and fingernails thoroughly after defecation. So once again, I go back to why it's so important to wash your hands and make sure that your fingernails are clean after you have had a bowel movement. Flies can carry it, so they can land on feces and carry it to food and sit on food and pass that organism on. When dogs ingest human feces, the organism can be passed at that point to the human. So that would mean basically if the dog ingests human feces, which is, in our day and age is very rare, but if they're out in the woods or whatever, and they're hunting, and they ingest it, you can come down with Shingalus from the dog that's carrying it. The symptoms of Shingalus is, in children, it usually produces diarrhea, tenesmus, which is basically where the child is straining to go to the bathroom. It's almost like a bearing down feeling for them. They can have a high fever, nausea, vomiting, distended stomach with pain, irritability, drowsiness. They can have pus, mucus, and blood in their stool due to the ulceration of the intestine. The same symptoms occur in adults, but they do not get the high fever with it. So these are signs and symptoms to be aware of if you think you might have some sort of a foodborne illness. You see Shingalus a lot of times will be like on a cruise ship where someone who is handling the food has or is a carrier of Shingalus and then ends up preparing food, and then the people eating the food get sick. Generally, the worst part of Shingalus is you're so sick you end up with an electrolyte imbalance, and once again, these are individuals that usually end up in the emergency room for fluid replenishment. Treatment for Shingalus, many strains are resistant to antibiotics, so they really kind of have to play around a little bit with what antibiotic they would provide. They do not recommend any anti-diarrheal drugs because all that does is kind of hold the bacteria in your system for longer, so you don't get better. as quickly as you think you should. Anybody that has been in contact with somebody that has Shingales may be prescribed antibiotics as well to prevent them from getting it. And control of Shingales is the same as any other disease with of the alimentary route, and that's the golden rules of WHO. Next is Salmonellus, and its proper name is Salmonella. There are only 10 species that actually cause Salmonellus. The individual that has Salmonella, it can be symptomless. The individual can be in a carrier state, anywhere from a carrier state to potentially fatal infections. Foodborne Salmonella, the incubation, once again, look at this, 12 to 36 hours. It can last several days or weeks. Some adults can continue to excrete the organism for over a year. So if you've had Salmonella and you've been treated for it, you can still have some of the organisms in your system even though you're not sick for over a year, and that person can still be considered contagious. When you think of Salmonella, think about anything that is poultry related. Generally, it is transmitted by an infected animal, food contamination during storage by the feces of an infected animal, especially rodents. Remember, a few slides back, we talked about rodents, mice, and so on being in someone's kitchen and leaving droppings. If you have food stored by those droppings, that very well could contaminate you. Food contaminated by an infected person during its processing or preparation. And you see it a lot in processed meat products. Inadequately cooked poultry or poultry products, raw sausages, lightly cooked foods containing eggs or egg products, unpasteurized milk or milk products, including dried milk. Coming up on Thanksgiving, you definitely have to think about Salmonella when you're preparing your turkey. There have been a lot of back and forth on how to prepare a turkey, and they used to say wash the turkey out, soak it in salt water. Now they're saying just pat the turkey dry. Pat the inside, pat the outside till it's completely dry, because you have more risk of contracting salmonellas by rinsing that turkey in your sink if it has salmonella and contaminating other things as well. Turtles are also carriers of salmonella, and a while back when I was younger, turtles used to be sold at pet stores as pets, and they've now been banned because of the fact that they carry it. Turtle soup used to be like almost a delicacy to some people to eat turtle soup, and it's in a cream base with the turtle meat. You will very rarely ever see turtle soup anymore because of the contamination of salmonella. The symptoms, sudden onset of nausea, vomiting, abdominal pain, diarrhea. You can have fever and chills. 3 to 4 weeks after the onset of the acute symptoms, meaning the nausea and vomiting, you can have arthritic symptoms. There is no specific treatment for salmonella, it's usually just going to be, once again, IV fluids and electrolytes to, get the patient feeling a little bit better and get them rehydrated. Prevention: any meats, eggs, and milk must be protected by sanitary processing. So, don't go to a farm and buy raw milk. It definitely needs to be pasteurized. Stored foods must be protected from rodent feces. Carriers of salmonella should not handle food. And salmonella is one of the foodborne illnesses that must be reported to the health department so that the health department can kind of target where the salmonella came from to prevent more infections. When going back and talking about eggs, you should not eat runny eggs. You should not eat eggs that are not completely cooked all the way through. Caesar dressing used to be made with raw eggs. I will never eat Caesar dressing in a restaurant because I don't know how they prepare it. They still may prepare it with raw eggs, so I won't eat it. If you're making cake or cupcakes and you let your little one lick the batter off of the beater, that's raw egg, that potentially can cause salmonella in the child. So nothing with raw eggs should be consumed. Campylobacter enteritis. Etiology is Campylobacter jejuni, responsible for 5 to 11% of all cases of diarrhea and dysentery in the United States. It can last anywhere from 2 to 5 days, but it can go as far as 10 days with symptoms. You're feeling better, thinking you're over it, and the symptoms reoccur again. Generally, it's harbored in animals, poultry, and human. Dogs are also frequent carriers. This is supposed to say lasting immunity. It lasts after the infection. So if you have come down with it, you're going to have immunity to coming down with it again for a while. There's no specific time frame, but you are going to have some immunity to it. Transmission is food and water. It may be contracted by contact with infected pets, wild animals, or other children that have it. The symptoms, once again, diarrhea, abdominal pain, malaise, fever, nausea and vomiting, and blood in the stools. You can be anywhere from asymptomatic, no symptoms at all, or you could be very, very sick with this. Once again, there is no treatment for it. Basically, it's going to be fluids and electrolytes. Prevention: all food from food sources should be thoroughly cooked, milk should be pasteurized, and water supplies should be purified. Next is cholera. Etiology, Vibrio cholerae. And it's a disease caused by an exotoxin, again, produced by the organism itself. Cholera, in severe untreated cases, causes about 50% mortality. With treatment, fatality is fewer than 1%. You do not see cholera in the Western Hemisphere. It's generally limited to Asia and the Eastern Hemisphere. The United States did have an outbreak in 1994, and there were 31 cases. And those cases were all directly associated, once again, with transcontinental transportation, where they had been to other countries where cholera was prominent. and came back with it. You see it more in lower socioeconomic groups in warmer areas during warmer months. So a lot of our third world countries obviously are going to be lower socioeconomic individuals. That's where you're going to see cholera. Humans are the only known reservoirs for cholera. The incubation period is generally 2 to 3 days. You could be a carrier of cholera that can last for months. The transmission, once again, is through feces or vomitus of the carriers or persons with active infections, usually spread through contaminated water supply. You might want to read up in the book where it talks about the tsunami that hit in 2000, I want to say 3 or 4. And they talk about the cholera outbreak, and that, once again, public health systems, our infrastructure, our water supplies, everything was damaged, and we had many diseases in that tsunami that were just rampant, but cholera was one of them, and that's just from, it was a lot of people there that were from more of a third world country. Cholera lived there, and it ended up just multiplying due to the feces and contaminated water. Hands, utensils, clothing, flies may contaminate the food or carry the infection directly to the mouth. The symptoms: acute, painless, and watery diarrhea, effortless vomiting. The individual usually will have white flecks, which is very indicative of cholera, that appear in their stool. Tetracycline, which is an antibiotic, is usually what's used. There are other antibiotics that can be used as well. Generally speaking, the individual is going to need electrolytes, fluid replacement, and the prevention is proper sanitation. And if you are traveling to a third world country, there is a list on the CDC's website what countries you're going to. They do recommend a vaccination before you end up going. It's not part of our routine vaccinations because we don't have cholera here. But going to another country and coming back, you're going to be more susceptible to the actual infection. So you can go to the health department and get the vaccination. And this is just a little cartoon comic that I found that in, kind of association with cooking turkeys. It says, the more germs, the merrier. We got a mosh pit inside and a meat juice pool filling up as we speak. And it's saying Turkey Thaw Fest, all bacteria welcome. And that just goes back to food safety, trying to let the individuals know that when you're going to cook your turkey, when you're going to cook your chicken, your frozen ground beef, you do not put it in your sink and let it thaw. You put it in your refrigerator so it maintains the proper refrigeration. If you throw it in your sink, it's going to get warm at some point, and your bacteria is going to start to multiply. So just a little food safety tip with a little humor.